Hello friends, today we are going to discuss a very important topic in the clinical medicine, finger clubbing. Okay, so we will discuss this topic under this following heading. First we will see what is the definition of the clubbing and how to examine this finger clubbing, that is the examination. Usually it is done in general physical examination. Then we will discuss about the grades of the clubbing. Then we will discuss about the causes of the clubbing. Okay. Many a times in our MBBS curriculum, this will be asked in the assessment, in clinical assessment, right from the first year in the subject physiology in general physical examination, and also in the final examination of medicine. Okay, this usually the causes of clubbing and grading of the clubbing and how to examine for the clubbing. Okay, and also we will discuss briefly about the mechanism of the clubbing. In between we will discuss about the epidemiology, that is how common the clubbing is. So under these side headings we are going to discuss this. First, the definition of the clubbing. So what does finger clubbing means? So usually this finger clubbing means it can occur either in the fingers or in the toes. Okay, so bulbous enlargement of the terminal part of the distal phalanx is known as clubbing simply. Okay, you can see this is a nail and the nail bed, that is this nail and this part, okay, skin part, that is this terminal distal part which is near the nail, that is also known as nail bed. So there is swelling of this nail bed or the distal part, bulbous like a bulb. Okay, that type of typical swelling of the distal digits of either of the fingers or even of the toes, okay, that can be considered as the clubbing. Now, how to examine the clubbing? So, first of all we should just see the fingers of the patient tangentially, okay, tangentially like this, laterally we should see. So, first what we should look for? We should look for the angle between the nail and the nail bed. Simply that angle, it is called as lovibond's angle. It is known as lovibond's angle. Okay, lovibond's angle. So what is this lovibond's angle? See, so generally if you see in a normal person, you can see on laterally, if you see, there is this angle between this nail plate and the skin, adjacent skin, that is the nail bed. So generally it is either 160 or less than 160 degree. But clubbing, by definition, it is the enlargement of this part, that is the nail bed part, due to the soft tissue inside, proliferation of soft or the connective tissue inside the skin. So whenever there is enlargement of this angle is arbitrated and it will increase above 180 degree or even 190 degree. So that increase in this normal angle, it is one of the sign of the clubbing. Normally it is less than 160 degree, it is also known as lovibond's angle, and if it is arbitrated or increased, then it is a clubbing. This is the first thing. Second thing is you have to see the ratio of distal phalangeal depth, that is depth, you should see the depth of the phalanx, distal phalanx, this is a distal phalanx, okay, small bones, distal phalanx. So depth of the distal phalanx, that is distal phalangeal depth ratio to interphalangeal depth, okay, that is to distal interphalangeal depth, this is the proximal interphalangeal, this is a distal interphalangeal depth, okay, interphalangeal joint, that is the interphalangeal depth. So normally it is 1, okay, but if it is greater than 1, then it indicates clubbing. Okay, how? You can see this is the 1. So distal phalangeal depth will be more because of the swelling as compared to the interphalangeal depth. You have to see from tangentially the depth approximately. This is the normal, this is seen in clubbing. So this is the second thing you should look for tangentially. First thing is this lovibond's angle and this one. Apart from this, you can see for the some fluctuation test. We will show you in some other video how to do the fluctuation test, or at the end of this we will show in the patient how to examine for the fluctuation test. Right now just remember these two important things tangentially. Then thirdly, you have to see for one sign. This sign is typically first described by a South African cardiologist, Shamroth. So it is known as Shamroth sign or Shamroth's window sign. Okay, Shamroth's window sign. So you have to see for this, how to check for this window sign is, usually the clubbing will first appear in which fingers? So usually it appears either in the thumb or the index finger, first fingers to get for the process of clubbing to start. Later the other fingers will also be involved. Usually it is bilateral, okay, and painless, okay. Sometimes it can be unilateral also, usually what I am saying. So either on the ring finger or any other finger where the clubbing you are suspecting, so just oppose the nails, okay, the nails of the corresponding fingers like this, okay, like this you should oppose. And normally if you do like this, you can see there is some window or a diamond shaped space is visible. That is a normal thing. If this space is obliterated or space is not seen due to this bulbous enlargement of the terminal part, that is the clubbing, then it is clubbing, okay. So you have to ultimately see these three things to tell the clubbing. So on this side this is the normal, these are the clubbing. So what first, phalangeal depth ratio, hyponychial angle, that is the lovibondsangle, it will be greater than 180 degree, then this Chambrot sign. So if either one of these are present, then you can say it as clubbing. So this is the method of clubbing. However, you can also see for the fluctuating nail sign, but it is not consistent feature of clubbing, okay. Many a times normally in some other clinical condition it is seen, but these are the diagnostic features of the clubbing. So this is the examination. Now let us discuss about the grading of the clubbing. Now you will see in different textbooks or some clinical method books, you will get either 4 or 5 grades. This I have taken from the Kelly's textbook of rheumatology. So in that, grade 1 is fluctuation and softening of the nail bed. That is, only the fluctuation test is positive and the softening of the nail bed, as such no clubbing is seen, not prominent. Grade 2, that is still it is mild. So increase in the angle of the, that is the Lovibond's angle, it is more than 160 degree. Grade 3, accentuated convexity of the nail bed like parrot's beak appearance. Grade 4, clubbed appearance like a drumstick appearance. So some in clinical method books it is fluctuation test positive, normal angle lost, and parrot's beak appearance, or grade 4 is drumstick appearance. So it's like this, parrot's beak appearance. So more convexity. Grade 3, many textbooks have said as parrot's beak, same like the parrot's beak. Or grade 4, drumstick appearance, similar to the drumstick. The fingernails appear similar to the this one. And grade 5 is development of shiny or glossy changes in the nail and the adjacent skin with longitudinal striations. If you see, that is grade 5. Sometimes even this grade 5 is associated with this condition, hypertrophic osteoarthropathy, so HOA. Okay, so earlier it was also known as associated with pulmonary disorders. So usually periostitis of the tubular bones, long bones, okay, it is seen. So in this condition, we will discuss about this condition some other time. Right now, just remember it is associated with clubbing, strongly associated with clubbing. So we have discussed the various definition, then we have discussed about the grades, and also we have discussed the examination process. Now causes of clubbing, okay, there are numerous causes of the clubbing. Now most important thing a medical student will find difficult how to remember. I will just tell you the mnemonic. So you should remember the first alphabet, like this, the spelling of clubbing itself, okay. So how to remember, just tell you CLUBBING, just remember that, and you have to find out the condition. First I'll tell you, before starting, how common the clubbing is. Okay, so in 2008, according to one of the research in Department of Internal Medicine, that is the general medicine, around 1511 patients were admitted. So out of the 1511 patients, only 15 patients had clubbing. That is only 1%. Just 1% of the patients which are admitted in a hospital are having clubbing. Okay, it's not so common, but it is one of the sign of some severe disease. Okay, now out of that 15 patients, only 40%, that is 6 patients had some problem, either lung problem or heart problem or any problem, which is a sign it was reflected as clubbing. And remaining 60%, that is 9 patients out of the 15 patients which showed clubbing, where after further evaluation we didn't find any severe clinical disease or condition. Okay, so sometimes, many times it is normal also. So if someone is having clubbing, don't think that he or she may be suffering from any lethal disease inside. Okay, it may be normal also, but however you should consult your doctor and evaluate for the clubbing. And most commonly this clubbing, if at all any systemic diseases is there, it is mainly due to the lungs disease, that is the pulmonary disease. 70% of the patients are usually the lung disease, and out of that lung disease, lung cancer is one of the most commonest cause of the clubbing, okay, remember. Then after that 20% is the heart disease, okay. Now heart diseases, how to remember the heart disease, only 2 or 3 important disease if you remember, more than enough. So congenital heart disease or cyanotic heart disease, C for cyanotic heart disease. Usually infective endocarditis and cyanotic heart disease are the cardiac problems, okay. Now as I said, the lung diseases are more common, lung diseases are more common. So how to remember few of the important lung disease, just remember A, B, C, D, E, F. So this under L, that is the lung diseases. What are A for? Lung abscess, A for abscess, okay. B for bronchiectasis, bronchiectasis. Now C for COPD? No. So most of you might be saying COPD. Just remember here one important thing. COPD, according to most of your standard textbooks, COPD is usually not associated with clubbing. Mind it. Remember this thing. So you can write, don't say COPD or don't tell COPD. Don't say COPD. COPD is not the cause of clubbing. Don't say COPD, because most of the clinical conditions in this COPD, if at all clubbing is seen in a COPD patient, it means that some other underlying lung pathology might be there, like lung carcinoma or bronchiectasis, okay. Remember, COPD usually is not associated with clubbing, okay. Now then C stands for cystic fibrosis, just remember cystic fibrosis. D stands for lung empyema. Then F for fibrosis. Just for the sake of, there are so many other diseases, just for the sake of remembering in a form of a mnemonic, CLU, okay. L for lung diseases, in that L, A, B, C, D, E, F you should remember. Then U, ulcerative colitis, okay, ulcerative colitis, GI tract problems, ulcerative colitis, okay. I will just write this with black color thing, CLUBBING. So clubbing. So each of this alphabet you can just make out your own mnemonic, okay. Again, B stands for either bronchiectasis, we already discussed, okay. We will write this one, GI problem, biliary cirrhosis. H stands, so one more, birth defects, whatever. I stands for infective endocarditis, then N stands for neoplasia, like lung cancer or even mesothelioma, then even in normal condition also, majority times it is normal. And G stands for some genetic causes, or you can either make it as some GI problem, okay, gastrointestinal problem, like same thing again, we have already mentioned Crohn's disease, I think. If we are not mentioned, you can write that Crohn's disease, inflammatory bowel disease, ulcerative colitis, however we have mentioned here. So this is the way how to remember causes. Then finally, what is the mechanism? How the clubbing, why there is a swelling as such, okay, when there is a lung cancer, why there is a swelling here or some other clinical condition, right. There are so many numerous theories have been proposed, but the most important one is just to remember this HCGN, okay, one of the, just I am telling you mnemonic. What are the causes for that is, H is for hypoxia, tissue hypoxia. So any clinical condition which causes hypoxia, due to the hypoxia again there is angiogenesis or some other problem, this one compensatory mechanisms which leads to the swelling of this soft tissues of the distal part of these fingers, okay, hypoxia. Second thing is due to circulating vasodilator, this hypoxia also causes vasodilatation. So circulating vasodilator, any chemical can causes this clubbing. Due to the vasodilatation, increased blood flow causes hyperplasia or hypertrophy of the tissue here, which leads to this bulbous enlargement, okay, circulating vasodilator, C. Then G, any genetic cause, and lastly N stands for neurocirculatory reflex, one of the neurocirculatory reflex. Now this neurocirculatory reflex, many studies proved this theory can be a cause of the clubbing, neurocirculatory reflex. So, this reflex is again the afferent pathway due to the vagus nerve. To support this hypothesis, if you cut the vagus, that is vagotomy, after vagotomy this clubbing is relieved. Or in general, whenever some underlying problem, lung problem, when it is treated, then it is reversible. Clubbing is reversed after the treatment of the cause. So, neurocirculatory reflex is one of the cause, and again few hypotheses says like deposition of the megakaryocytes, that is platelets, megakaryocytes. So, what happen is they are usually produced in bone marrow, okay, and they are usually after the production, when they enter to the pulmonary capillary, they are sequestered there. But when there is a lung disease, okay, or some other pathology, so this is bypassed to the systemic circulation, and this megakaryocyte or the platelets, they get deposited to the systemic circulation in the digits, and they release these chemicals, what platelet derived growth factor or vascular endothelial growth factor, okay. So, these factors will again causes the hyperplasia or vasodilatation or angiogenesis or AV formation, arteriovenous vessels, okay. So, these all hypotheses, there are so many hypotheses, again there are things which disproves this hypothesis also. Anyway, these are the possible mechanism by which the clubbing occurs, okay. So, today we have discussed about this clubbing, causes of clubbing, how to examine for the clubbing, okay, grades of the clubbing and the mechanism of the clubbing. Thank you. Now, let us see how to examine for finger clubbing. As you know, clubbing is nothing but the bulbous swelling of the terminal part of the distal phalanx, okay. Here there will be swelling generally in clubbing. Now, it is a normal finger here. So, how to examine? So, first thing is you have to see tangentially the finger. Normally there will be no swelling here, but in the clubbing, finger clubbing, there will be swelling here, okay. So, the angle which is found by the nail and the nail bud, it will be increased. So, I will just show that angle. It is also called as a lovibondsangle. So, with the help of the scale, normally you need not use the scale, just for the sake of understanding the concept, I am just showing it. So, see at the junction of the nail and nail bed, if we keep this is around 160 degree normally, okay. But when there is a swelling here, so this 160 degree it will increase to 180, and more than that, that is 190. If it is more than 190, then it is clubbing, okay. So, you have to see this lovibondsangle. If it is more than 190, then it is clubbing. Then one more test is you have to support this pulp of the finger with the two thumbs here like this, and with the help of two middle fingers you have to support the proximal interphalangeal joint, and with the two index fingers you have to keep at the level of the nail bed, and alternatively you have to press your index finger and feel for the fluctuations. So, normally there is a slight fluctuation, but if at all there is a swelling here or clubbing, then you will feel more fluctuation as if the nail is floating on the nail bed, okay. It is also called as the floating sign, okay, like this. So, this is not so reliable, but this is one of the sign. But this onychodermal angle or the lovibondsangle, and this thing, one more thing from tangentially, the depth at the interphalangeal, distal interphalangeal joint, and at the depth at the nail bed you have to see. This depth at the level of the nail bed will increase in the clubbing, okay. This thing, one is onychodermal angle, and the depth at the level of the nail bed will be more as compared to the depth at the distal interphalangeal side. Two signs. Then finally, one more is Schomburg's sign. So, Schomburg's sign, you have to oppose the two corresponding two nails, okay, of the two fingers like this, and you have to look for the diamond shaped space. This is also known as Schomburg's window sign, okay. So, if it is visible, then it is a normal. If it is obliterated due to clubbing, then clubbing is present, okay.